The two tests to kind of look at OA would be the scour test and the quadrant test, and those are pretty similar. The scour test is when you're just putting a posterior pressure through the hip, and you're just kind of going back and forth with it like that. See if that reproduces their pain. Okay? The quadrant test is when you're taking them to their end range and then putting a force through that, and then taking them over to the other quadrant and putting a force through that to test.
Is it the same as like the Faber and Fidere?
No. Faber's is an SI or hip where you actually cross and put pressure there. Similar but a little different. Okay, so that'd be a quadrant and scour test. And then, so if they have OA, you're gonna probably reproduce pain with either or both of those, and you're gonna have some capsular limitations here with the range of motion. Okay. And then let's see, the other one that I would do, if I'm suspecting a hip fracture, which hip fractures are pretty rare, but sometimes we're the first ones to catch those. And I've caught 2 or 3 in practice because the patient has hip pain that starts pretty acutely. They either go to their primary care or the ER and they do an x-ray, which is negative, and they come in and they're still having pain. And that's because they have a hairline fracture that didn't show up on films, which is very normal. And so we have to be aware of that. Usually they don't like to put a whole lot of weight through it because that hurts. An interesting test is, I think it's called the auscultation test, when you actually get a stethoscope and put it on the pubic symphysis, which is kind of a weird thing to do, and I tell the patient what I'm doing first so they know. And I'm going to tap on their asymptomatic patella while I'm listening, and I'll hear that percussion coming through, and then I'm going to tap on their symptomatic patella. Because if there is a fracture in that bone, that vibration is not going to go all the way through, and it sounds different on one side than it does on the other. Kind of an unusual test, but if you can hear a big difference, then you're thinking that might be a pretty specific test telling me that there's a fracture there.
Is your stethoscope like on the skin, or you?
No. I just put it, and I may even give it to the patient and just say, here's what we're going to do. I'm going to listen this side tapping compared to this side tapping, because I think you could have a suspected hip fracture. And so usually once you kind of go through that, they're fine with that. Okay. And then let me have you sit up. And then one of my favorite ones is called the fulcrum test. And so what you're doing here, if she has pain in this hip, I'm going to put my hand under this thigh and just press down. Okay, shouldn't hurt. That feels fine, right? If she has a little bit of a stress fracture in the neck of the femur, what's that going to feel like? Yeah, she's going to come up off the table. And so that's a very, again, specific test. If that's positive, the likelihood ratio of them having a hip fracture is pretty high. And so then you would say, get on the phone, hey, I know they had a negative x-ray, they had a positive fulcrum test, which is pretty specific. I would do either a bone scan or MRI and see what they think they have a hip fracture. Cool? So that's hip. So you've ruled out hip. Okay? SI. Let's look at can we look at your SI?
Yeah.
Okay, so lay flat on your back to start with. With SI testing, I think this is in your notes. There's lots of ways to look at SI. I still will palpate and look at symmetry of SI, but I also know that reliability and validity of that is decreased because it's really difficult to palpate and it's really deep when we're looking at the SI joint. And the SI joint is there's so many variations anyway between normal symmetry that doing that alone is not as reliable and valid as doing provocation tests. And doing one provocation test for the SI is not very helpful. If somebody has a torn ACL and you do a Lockman test and it's positive, that's all you need to do, right? With the SI testing, you need clustered tests. And so the best likelihood ratio is to do a group of tests and determine how many of those are positive, and that will indicate the likelihood ratio of SI, okay? So there's a guy named Laslett who did this and came up with, I can't remember if he has 5 or 6 tests, but if you do all of these and 3 or more are positive, then they have a very high likelihood ratio of having SI, which I think is in one of your slides. Okay, so these tests are as follows. So the anterior gapping test, which you just go in ASIS, and I usually cross, and I'm putting a posterior lateral directed pressure, because I'm trying to gap the SI. Okay, holding that pressure. I try to get directly over midline, so I'm not shearing just one side, and I'm short, so I usually have to take the length down and get directly over like this. Have y'all learned this one before?
Mm-hmm.
And some studies say you have to hold that for up to 3 minutes. Why would that be? For creep. Which that can be a little awkward. Hey, I'm going to hang out right here for 3 minutes. So use your discretion on that. And if you feel like that may be what's happening, then you do probably need to stay there for a while and tell them why. Okay?
Will they typically have symptoms present way before that, or is
They
that
could, yeah.
something that's like it needs to be 3 minutes?
It needs to be a while, because remember your SI joint has 5 major ligaments around it. You got the sacrotuberous, the sacro, what else ligament is? Anterior, posterior SI ligaments, and then I'm forgetting the big one on the posterior side, but there's like 5 major ligaments there that are supporting that. The other thing to remember about the SI joint is it's both a synovial and a fibrous joint. The anterior part of it is synovial, and it's made to move slightly. The posterior side is more fibrous, so it's made to take forces, and so you have to put a lot of force and hold to really promote symptoms, okay? So that's the gapping test. The one that's called Gainsland's test, you're gonna come over this way just a little bit. I'm gonna have you bring this knee up, and we're gonna let this leg drop down. And we're putting a posterior pressure here and a flexion type movement through the hip. Okay, and so that's trying to kind of shear that SI joint.
What was that called again?
That's called Gainsland's test, is what I see it called most often.
Which side of her SI was using for that?
You could do either. I would test both.
With that pressure though, which side are you looking for?
It's 50-50. It could be either side. Because you're causing a rotation. So I usually would test both. If she has left-sided symptoms, I'd probably start extending that and open up the other side, but I would definitely test on both sides to see. Okay, and then, okay, the other one here in this position is the, do you have your list of tests? I'm forgetting the name of it.
I really don't know that we have a list.
Did I list them all for you?
Mm-mm.
Oh, I didn't? I'm so sorry. Okay. Sacral shear, I believe is what this is called. Okay, so from here, this is like the thigh thrust, except the only difference is I'm going to rotate you over, Lindsay. I'm going to put my hand under the sacrum and then bring her hip up, and now I'm doing kind of like the shear test or the scour test, but I have my hand right behind the sacrum, and so it's creating more of a shear at the SI joint versus the scour is just getting hip here. If I put my hand under the sacrum and block that and put that pressure through, now it's getting more of a shear through the SI test. Okay?
Are you testing the infield on the sacral?
No, these are all symptom provocation tests. Yeah. You do want to get to an end range because that's what's going to be most likely to provoke those symptoms, but these are all symptom provocation. Okay, and then lay on your side. Either one. So if she's got right-sided pain, I'd have her lay this way. Go here, knees flexed. And again, this is another gapping test. I'm going to go here, and I'm putting pressure here, and now I'm trying to gap or open up the posterior part of the sacral leg.
So like anterior, what direction should go?
Straight down. So we're trying to gap like this. So our SI is like this. I'm trying to take that iliac crest or the iliac bone and put kind of rotation force on it, so it would be kind of gapping those posterior ligaments.
So the supine cross gapping would be right.
Anterior, yeah. So this is going to provoke those posterior ligaments.
You call this the lateral thing?
You know what? There's a link. I think I did put the link on
Yeah.
there. And I put that there because you can actually, if you'll put that into your browser, and pull up that website, it'll show you a video for all 5 of these tests, which is really cool. And it gives you the name of each one. And I don't want to tell you the wrong names. I think this one is called the lateral shear or something like that. And then lay prone, this one's the sacral shear, which on this one, I'm just finding sacrum right in the midline of sacrum, and I'm just putting a posterior to anterior pressure through the sacrum. And again, I may have to hold this one with some end range pressure to try to provoke some creep, and I'm seeing if that reduces symptoms. Okay? If only one of these produces symptoms, then your likelihood ratio is low that it's SI. If you have 3 or more that are positive, then you're thinking there's something going on with that SI joint. And depending on which test is positive, that may help you kind of decide which ligament may be involved, or if there's some hyper versus hypomobility there, and what you need to do as a result. Okay, so I really like using the cluster test because that's going to give you a better indication of what's going on.
For all of these, are you holding them for about 3 minutes? Or
It's going to take you forever.
Well, yeah, I
but
mean,
yes,
it's like
the main one they say to hold for 3 minutes is the anterior guiding. I did have a really unusual case once. There was a man that I was holding, and he reached down and put his hand on my hand. So I'm like, hey. Yeah, so
We're only a minute in. No,
yeah, so that's why I'm always like, I don't know about the 3 minute thing. So I usually just tell them, hey, here's what we're gonna have to do. We're gonna have to
I'm out.
do this gapping test. I usually bring somebody else in the room with me. I'm showing this person some of these tests and just have them hang out, just so that nothing unusual happens. Okay. Okay. Cool. Thank you so much.
Just really chippy.
Okay, so that's hip and SI stuff, just briefly, so you kind of see some of that stuff. Okay. Now let's look at a lateral.